Okay.
Just keep smiling, everything is good.
Just give me a second. Tom, I'm going to be on a Zoom for 1 hour. If you need me right away, it's going to start in a minute.
Okay, I just wanted to ask you.
Good afternoon, everyone. Thank you for joining us today. This is Nazira Dawood as the host for your Chai and Just Chat. We are into our 5th year of Chai and Just Chat sessions. Every month, we've not let any sessions go. So today, the difference is instead of a weekend, we are doing it on a weekday, and sometimes we have to make those changes, and this is a quicker session. Usually we've had it for 2 or 2.5 hours with more panelists, but today's session is different because we have 2 experts who's going to talk about Medicare today, which might be of interest for many, which might not be relevant at this time, but it's good always to learn of something that's going to come in our future life, right? Either for our parents or for ourselves. I have my chai as usual, and of course my water too. So sit back, relax, and again, because this is a shorter 1-hour session, we hope that you gain the information from us today. And you're welcome to, if you're joining us through chat, and if you've logged in, please do ask questions through the chat, and I'll make sure that I incorporate those questions. You've also entered some of your questions during your registration. We'll ask those questions of the panelists as well. So I would like to introduce quickly Roselle Watson. Thank you so much for joining us, Rosie, today.
Thank you.
Yeah, this was such a short planned session, and you've joined us still, so we appreciate your time this afternoon. Rosie, if you can tell us a little bit more about yourself before I go to Amir, please.
Okay, well, my name is Roselle Watson, and I'm happy to be here, happy to share, hoping that I can help with those of us who are on Medicare and those of us who will be on Medicare, that somehow I will inspire you to start taking action now and learn as much as you can. And I'm happy to share what I know.
And thank you again for your expertise today. We have with us also Amir Sultan. Amir, thank you for joining us. I know you have several feathers on your cap, but how I know you is as a well-seasoned financial professional. But please give us a little bit background so others know who you are.
Sure, absolutely. Just like how you said, I've been in the financial industry now is on 4 years, and what really caught my attention with the Medicare is because I have a personal story to share with my mom, who went through a lot of stuff, and we were looking into resources, and we found what these options were, and it just compelled me to share with the community out there. And knowing who you are also, Nazira, you are connected to a lot of these communities that don't have this information. It's very important for me to get the word out. So we optimize everybody when they reach that stage for this type of information, like with the Medicare. What does it all mean? The maze that we have to go through to get to where we need to get to, right?
Yes, definitely. So thank you so much, Rosie and Amir. Before we get to the core questions, I do want to ask you, just to ease out the warm-up questions. Rosie, what is life all about?
Life all about for me now is taking care of my sister and her husband, who both have Alzheimer's. That's my main focus right now. It does take some time, but I still carve out time to help the community, my circle, with whatever information I could share about what to do before you get sick.
Definitely. Thank you, Rosie. That was really nice that the families have each other. So Amir, let me ask you a question. Amir, if you had to write a book about yourself, what would the title be and why?
Oh, title would definitely have to be a servant leader, right? I mean, I don't consider myself a leader that is going to tell people what to do. I share with what I know with all my heart. I want people to be inspired with what I do. I want people to know what the choices are out there, right? And then, for me right now, I'm living in a time where my wife's mom and dad, I've seen so many challenges. We've been very proactive on trying to get the information. And for me, it's all about how I appear to the rest of the community as somebody that wants to share and empower and motivate people, just like how Rosie said, to really get the information and to take action. So you're not caught, you know, um, from the blind side and you don't know what to do.
Okay.
My job is to give that information so you know everything that's out there and you don't miss out on what you could be getting.
Very well said. Thank you. That would be a
Yes.
good title to read. And thank you, Amir. So let's get to the topic for discussion today, which is Medicare, right? So I know there's A, B, C, D. I don't think there's
There's a
E,
lot.
but F, J, K, L, M, and under
There's a
those,
lot.
yeah, under those there are
Yeah.
subcategories. So it's a huge topic. I know we can't cover it completely for the 1 hour that we have today, but definitely tell us a little bit more, Amir. Like, what is Medicare? I know it's a federal health insurance, but tell us some of the who's eligible, and also
Yeah.
tell us first what is Medicare.
So Medicare is your entitlement since you have worked in this country for 10 years or more. When you reach the age of 65, the government, it automatically gives you Medicare Parts A and B. All right. So it is not that you have to work 10 years and then you get it. There are some situations where you can still get Medicare before the age of 65. If you have a disability and you have been disabled for 24 months, then Medicare is also available to you. But for the most part, it's at age 65 and it's usually A and B. So A
Okay.
covers all your hospital stays.
Okay, we'll go into the details of Medicare. But Amir, so you said anyone who's worked for 10 years. So
Correct.
suppose someone is in H1 or business visa or visitors or any visa, and they are working in US for 10 years. Does that make them eligible?
As a H1, yes, but not as the visitor visa. So the visitor visa, you're not really granted work status. I mean, I know people, they do work, but you have to be able to pay your taxes for 10 years. You have to work a certain amount of hours that you have to get over the next 10 years to be eligible. Unless you get disabled, that's something different. But generally, it is available for H1 for if you are a US citizen, if you have a green card, that is available to you as well.
Oh, good to know that. It sounds like Social Security, though, Amir. Is that similar?
So it is part of it is part of Social Security. So Social Security gives you, it's like a pension plan. So as you pay all your taxes throughout those years, Social Security gives you when you retire certain amount to live off every single month, right? That is going to be different for everyone. But Medicare Parts A and B, irrespective of how much you get for Social Security, you will still get covered if you meet certain criteria.
Okay, sounds good. So, Rosie, we just talked about eligibility for Medicare. So, I'm not going to ask your age, but what I'm going to ask is, Rosie, tell us how was your experience getting into Medicare and when did you have to sign up for it?
Well, Medicare, it just happens automatically. Um, I was self-employed. So one day I just started getting things about Medicare. I hadn't even thought about Medicare. So I started getting the information. I get a card and I don't know anything about it, never bothered to look into it. And this is what I hope people won't do. They won't just, get the card and just put it in the drawer because, at the time I really didn't need it. So I never thought about anything, but I'd like to share this one experience that I did have and I am still having because I didn't look into, let's say, getting a prescription plan. So because I didn't get the prescription plan, I'm going to pay a penalty until I die.
Hmm. Yeah.
And I would not like for that to happen to anyone else. So I went looking for, I'm getting older now as opposed to when I first got on Medicare. So, people are saying you should get a prescription plan. I said, but I don't need one. So I said, okay, let me see about getting one. So I tried to get one. And because I didn't get it when I originally got Medicare, I had to pay the penalty, and that penalty lasts for a lifetime. It doesn't go up, but it is monthly. I have to pay the penalty monthly. So that to me is something that people really don't go by, the fact that you're not going to the doctor. You feel good. No, you have to get a prescription plan.
Right.
So,
Oh my.
I'm sorry, Amir, did you say something?
I said that you're right.
Yes.
Oh my gosh, Rosie,
So-
my mouth is still like in awe. I'm like,
Yes,
really?
and I do. I have to pay that monthly.
Oh my gosh.
So sometimes, we don't delve into things, we don't research, and everybody isn't going to tell us everything. But the information is available. It was available to me. I just didn't seek it out, bother to, for whatever. So that's something I would like for people not to experience. But other than that, most of my experience with Medicare has been with my mom, who was never sick, really. So she wasn't going to the doctor that much, but just ended up in the hospital at one point. And if she didn't have Medicare, her Part A and B and whatever else, I don't know what would have happened to us financially. So I would say it's something that everybody needs to know if they are entitled to Medicare, to pursue information about Medicare
Wow.
and know all that you should know.
Great information shared, Rosie. So basically, when they do get Medicare, what you're saying is they have to sign up for the prescription plan during the eligibility period. If they don't sign up during that time, they end up being penalized for the rest of their life.
Yes.
Okay. So there's no way to get excluded from being penalized?
I think there may be a way, if you're on Medicaid or something like that.
Okay, sounds
But
good.
there was no out for me.
Great information, Rosie. So, Amir, let me come back to you. So that's
Sure.
sometimes shocking information, or rather new information and much needed information that we are also learning. And like I said, as I started this session, that this information as of now might be much irrelevant, just like Rosie felt at times that it was irrelevant to her till the card arrived. So it's
Right.
always good to know, to be pre-planned. So tell us, Amir, so we talked about the eligibility, we talked about the age requirement. So as Rosie said, is it automatic? So do people just wait to get automatically enrolled, or do they have to do anything before that?
So they will send you out a letter saying that you are eligible for Medicare, and to enroll in the prescription drug plan or any other plan like an Advantage plan, it's 3 months before you're eligible and 3 months after you're eligible. So you have a window to really get on something.
Window of 6 months
Window of 6 months.
during
right?
your 65th birthday.
Your initial enrollment period, they call that the IEP, the initial enrollment period, is whenever you're eligible. That the first of that month, you can get into a plan 3 months before that month and 3 months after. So 7 months. is
Okay.
what you have.
On the 65th birthday.
Correct.
Plus or
Correct.
minus. Okay.
Plus or minus.
Okay, sounds good. So there's no need for anyone to go up and fill up an application. We just wait for the card when we turn 65.
Yeah, the card will come, and then I'll tell you what happens. Then will come all the calls and all these things, and you'll get bombarded by so many things that you don't know what's going on.
Okay,
You know,
got
and
it.
that's when you truly need somebody, a professional, to really sit down with you and really explain to you what exactly everything means, how it can impact you, and what you can do going forward, so you don't have these late enrollment penalties and things like that.
Okay, it sounds good. So I remember at some point was this enrollment age, eligible age at 63, or
Not that I know of, it was always 65.
it was always 65? Okay,
Now you
good.
can start to take out Social Security as early as 62.
Okay,
All right. And the officially now the age to, if you want to wait and get maximum benefits, is 67, but Medicare by itself is at 65.
okay. So Rosie, tell me if what I'm saying is correct. So Medicare is not free, Medicare is not Social Security, and Medicare is not Medicaid.
To my knowledge, Medicare is not Medicaid. A person can have Medicare and Medicaid, but it's definitely two separate coverages. And it's not you're entitled to Medicare, but you do have to pay. They take something out of your Social Security check every month to pay your Medicare premium.
Okay, sounds good.
So I think every year it goes up. I think, it's maybe about $200, $125. I think it's what I started at, but it's every month. You have no choice. Before you get your Social Security check or, electronic transfer to your bank, that Medicare premium comes out automatically. So they don't give it to you and then you have to give it back to them. They
Okay.
just take it out.
Okay, so Rosie, you mentioned at some point that you felt you didn't need the Medicare card. So am I right to assume that you were already having an employer insurance?
No, I just didn't feel sick or, I really wasn't going to the doctor. So I just wasn't paying Medicare any attention. Like I should have been paying Medicare attention. I just took it for granted. And then maybe also the denial about, hey, I am getting older, so I'm like, I don't need that. But we don't want to do that anymore like I did. Yeah.
Okay. So Amir, is it true that anyone with end-stage renal disease is eligible for Medicare?
So, end-stage renal disease is a chronic condition. Okay. So that will usually get you into Medicaid, not Medicare.
Okay.
Now, when you have Medicaid, after you are disabled for a couple of years, then Medicare will start. And then you'll be enrolled in both of them, Medicaid and Medicare. So Rosie is right. You can have them both.
Okay.
Okay. And she's also correct that there is a cost for Medicare.
Yes. Okay.
Okay. So I don't know if you want me to go into all
Yes.
of that as well.
So let's talk about the parts of Medicare. Like as I mentioned, A, B, C, D, E. I don't think there's F or G, but anyway, please
There
tell
is,
us.
there is,
There
there
is. Okay.
It'll
It's
be
going-
overwhelming if I go into all of that, but I'll give you the basics.
Yes, please give us
The
the
main.
basics. All I know is usually people are talking about part A or part B, but I know there are many other alphabets to it.
Perfect. So Part A and B is what you get when you're Medicare eligible. Part A does not have a premium. Okay? But Part A does have a deductible, which is currently right now $1,556 in the first 60 days. Once you meet that deductible, everything else is covered. Part B, like what Rosie said, yes, has a monthly premium. Just like a health insurance plan, the government is going to charge you a premium. That premium currently is $170.10 every month coming out of your Social Security check before you even know it. So people say, I get insurance for free. It's not free. You may think you have it for free. Okay, but that is taken out before you even get the check. Okay. Now, there is an instance where you can get it for free if you have Medicare and Medicaid. If you have them both, Medicaid will pay that Part B premium. Then if you have them both, then yes, you do not have any charge for your Medicare and Medicaid.
Okay.
So far, so good?
Yes. So far, so good. But yeah, I am starting to get confused. But please go ahead.
Yeah. So the main parts of Medicare is A, B, which is Part A is for your hospital coverage. Part B is going to cover your doctor and your outpatient visits. Okay, so that is pretty much everything there for your doctors and your hospital stay. Then you have Part D, which is for your prescriptions.
So no C.
I'm going to come to C.
Okay,
Okay, I have to go to A, B, and D, and then come to C, and
got
I'm
it.
going to tell you why. So when you have Part A and B, now you have two options. Okay, you can either get what Rosie has right now, which is a Medicare supplement insurance, and then she can get a Medicare Part D. Now that's called part of the Medigap. So that's the gap that she has to cover because Medicare covers 80% of the cost and 20% is on you if you don't have Medicaid. So how do you cover that 20%? Right? You can either do it with option one, which is what she did, Medicare supplement insurance, and a standalone Medicare Part D, which is your prescription. Okay?
Okay.
Or what a lot of people do is what they call Medicare Advantage. Medicare Advantage takes parts A, B, and Part D and rolls it into one plan.
Ah, got it. Okay.
That is Medicare Part C.
AB plus D is equal to C.
AB plus D equals C.
Yay! Okay, that's a new
Okay.
formula. Okay.
That's the new formula. Now, what happens is when you get into a Medicare Advantage plan, which is a Part C, the government, which was your primary provider for A, B, and D, will say, hey, look, this company that you have chosen, whoever it is, we will give the contract to them and they will be a new provider, whoever that company that you choose to go with. Right?
Right.
Premiums will be between $0 and $15. It could be, a lot of them are $0. Some will be a charge depending on the benefits that you want. Because these major companies, when they get that contract, they can add in their own benefits to spruce it up a little bit. It could be dental, it could be vision, it could be hearing, could be a lot of other things.
Okay.
Right?
Yeah.
So that's your Medicare Part C. And that's why people are so attracted to that Medicare Part C, because now instead of carrying a card for your prescriptions, carrying a card for your Medicaid, or carrying a card for Medicare, everything is just one card. You will still have everything, but it's all under the umbrella now of Medicare Part C. Part C has A, B, and D.
Okay.
Right?
Yeah. So
I also, yeah.
Go ahead, Amir.
I want to talk about why people sometimes will go for a supplement versus the Advantage. So, there are times when a supplement covers pretty much any doctor you can go in the country. And some supplements will even give you coverage outside of the country. Right? For our community that goes to India and overseas, a supplement will cover some doctors over there for routine care, not just for emergency now. Okay? Now, a Medicare supplement, because it offers that, has more of a premium. So the average premium there, you're looking at about $150 to $200 a month for that. And if you go that route, you have to pay a premium for your prescription drugs as well, between $70 to $100 a month there. So it's a more expensive route, but it's going to cover pretty much everything.
Okay. I'm learning so much, Amir. I know I didn't take time to learn all this.
It's okay.
It wasn't relevant before, but and it's not relevant for a few more years probably. But still, I want to be able to tell people whom I meet with about some of the information. So it looks like D is people can choose D based on the more benefits that they get and benefits, but D seems to be just like simplified everything together.
So Part D is just prescription.
I'm sorry, the C seems
the C
to be
is the all-encompassing one, right?
Got it. Okay.
C is the one that gives you what a lot of people when they get older, they're really looking for for like your dentures, for your hearing, for your glasses. Sometimes you may get over-the-counter benefits, many different things. C actually gives you the best coverage. It brings everything together into one package.
Okay, let me get this right. Let me know if what I'm saying is correct or wrong. Suppose I'm 65 and I'm still employed with this big company and I'm still, well and able to offer my services to the company. It's a huge company of more than 20 employees, and I have insurance through them at 64, at 65, and they're willing to cover me for 66.
Hmm.
Can I just tell Medicare, hey, listen, I'm really don't want your service now because I'm very well covered here through my employer?
Absolutely. Absolutely. What the government and Medicare wants to really know is that you are covered. Whether if you're employed at 66 and you're happy with that coverage and you can prove that you're covered, there is no penalty. You don't have to take a prescription coverage or anything like that.
Okay. What if I'm not employed and I can still afford private health insurance that gives me everything I need at age of 65? Can I
That's up to
convince
you.
Medicare?
Absolutely. As long as you're covered.
Oh, so
If
it
you
doesn't matter whether I work or not work.
as long as you're covered private or with your firm who's offering you
Oh.
health insurance, Medicare will leave you alone, no penalties.
Wait, so I can be self-employed and not be with any employer, and I
Yeah,
mean
you can
not be employed by someone else, and I can be self-employed and I
you can
have
go to
full
the
coverage.
marketplace and you can get yourself your own insurance if you'd like to. You can go to Kaiser and get your own coverage if you want to. Whatever you want to do. Medicare
So,
is just is making sure that you're covered at the age of
so
65 plus.
Medicare is really not forcing me then.
No, it is not going to force you as long as you have credible coverage.
Ah,
You
okay,
must have credible doctor coverage and prescription coverage.
okay. And go ahead, Rosie. Please go ahead.
So in my case, I did not have credible coverage. So then
Got it.
Medicare would force a person like me to
Right.
have Medicare so that they ensure that I am covered.
Got it. And so then they would penalize us if we are not covered and we didn't enroll with Medicare. Did I get that right?
If you're not covered,
And I still didn't enroll for Medicare at
right,
65.
because they don't want to cover you when you get sick. They want you to take preventative measures and be proactive so that the government doesn't incur a huge cost.
Okay.
That's why they will levy those penalties on you.
Okay. So we talked about Part A, which is hospital insurance. Can you tell us, like, is that normal, like inpatient or outpatient services?
Yeah, that is for, so it'll cover you up to 90 days, right, for your hospital stay. There
Okay.
is a charge per day in whichever hospital that you go for, but there is a deductible that you will have to meet. So days 1 through 5, days 1 through 3, depending on the hospital, how they will bill, uh, uh, how they will are going to bill your insurance, which is Medicare. It's all going to change. Medicare Advantage has many different levels depending on what company you go with.
Medicare Advantage is C.
Medicare Advantage is C.
Okay.
So they will have their own network of physicians and hospitals that you go to, so you don't incur as much cost on the days 1 through 5. Right? Some will be days 1 through 3. Some will be more on days 1 through 3, less on one. There's so many variables. You have to look and choose and see what's really good for you and what you really want.
Okay. So, Rosie, tell me more. Like, how did you, after you received the card, so did you start learning about, more about it later? Did you go through a professional expert like Amir and then sit with them to understand more? Or did you take an effort to learn yourself because it's too much to understand at 65?
No, I did not. And I don't recommend that for anyone that's listening or anyone that they can share with not to do that. It is best to seek out professional help so that you don't end up in the predicament that I'm in right now. And you also, like, I didn't even know about, let's say that every year I can get a wellness exam. So I wasn't taking advantage of that. if I had sought out some help, some information from a professional, I would have known about that.
Right.
So I had Medicare for about, well, let's say maybe 7 years before I ever got a wellness exam.
Okay.
And, and that's not a part of your deductible. And anybody can get that. And lots of times people are not going to the doctor because they don't have the deductible. They're concerned about the deductible. They don't want the bill. So they never go. But you can go and get a wellness exam. You don't have to pay for it, and you don't have to pay a deductible to have it done.
Okay, great to know. So, Amir, tell us, is there something called original Medicare, and does it still exist?
Original Medicare is what you get at the age of 65.
Okay.
Original Medicare is A and B.
Ah, got it. Okay.
Okay?
Yes.
Supplemented by the prescription, which is Part D. You
Okay.
can go that way if you want to. You don't have to take a Medicare Advantage. You don't have to take a Medicare supplement. It all depends on a case by case what is really good for you. Like Rosie was saying, these wellness exams on a Medicare Advantage, which is the Part C now, if you go that route, these hospital networks, etc., put a lot into their preventative programs. X-rays for your dental, fluoride treatments, free eye care, free eye exam every year, free hearing exam with hearing aids. So many things are there, which is not part of original Medicare. So they won't cover as they have a certain area that they will cover. They have some doctors that will cover original, or you can go with Advantage, and you can see exactly what doctors you want to see if it's covered by that network, and then you go that route.
I was going to ask you that question as well. But is this the right time to ask you all about the other alphabets of Medicare? So we discussed A, B, C, D so far.
The others are really for if you have Medicaid as well.
Okay.
That is a whole different scenario. Like, for example, if you have something chronic like diabetes, if you have something chronic like cardiovascular disease or end-stage renal disease, then you have a lot of additional parts in there. I don't know, I think that's going to be a lot of information overload here today, is what I feel. But yeah, there is other letters. There is Medicare parts J, K, L, M, N. I mean, that's just a lot to go through.
So that's probably, these alphabets are based on just some of the elements of coverage, I believe, I guess.
Yeah.
Okay.
90 to 95% of the people they need to know about A, B, C, and D.
Okay.
That's really where everything lies. As you talk to more people, in conversation, you'll find out if something else is better.
Okay,
right?
Got it. So as a person without Medicare, when we all have health insurance, we are normally looking for in-network doctors, so we don't pay more out of pocket. Is that true for people with Medicare health insurance as well? Do they have to look for in-network, or there are doctors who opt out and say, sorry, we don't take Medicare patients?
So there are two different types of Medicare plans. You have what's called an HMO,
okay,
which
yes.
is everything is in network. Okay, if you go out of network, it's not covered. You will see your primary care is covered in that network. He will recommend in that network, so you go see everything. Pretty much you're trusting your doctor to make all the decisions for you, to see whatever doctors that he's recommending. Or if you want more flexibility, then you will do what's called a PPO plan. Okay, a preferred provider organization. So you can go outside of the network without a referral from your original PCP. Now you will pay a small premium per visit, maybe $20, $25, whatever the case is on the plan, where your primary PCP may be free. You go out of network, you're still covered, but there may be a small copay. But it gives you that option for you to really have the freedom to go and see whoever you want to see, and not have your doctor kind of dictate where you can go.
Okay, so Rosie, I don't want to pry into what sort of a service you have, but do you think people prefer having a PPO or a HMO when they get Medicare?
I think it's based on who you are and what your needs are. Like for me, I move around a lot. So I prefer not to be confined to an HMO where I have to go to a doctor that's, let's say, in Atlanta and I'm in Nashville, I'm in Florida. So because I move around a lot, it's beneficial for me to have the peace of mind that wherever I am, I can go to the doctor if I need to and not have to worry about paying, an exorbitant, unexpected fee after they've served me. So for some people who they don't go around that much and they like these like my sister, she has advantage. She can go to the gym, I think, or she just has dental, as Amir said. She likes the compact plan. So on the other hand, I have to have a dentist that I have to pay for myself. I have dental insurance, but it's not connected to my
Okay.
Medicare coverage. It's separate. So my coverage for my dental is separate. My coverage for my prescription drug is separate. Whereas with Advantage, it's more compact, but it's not the best for me because of what I do, how
Okay.
often I'm not at home.
Got it. So people have to tailorize to their own needs, which one they prefer, rather than just take one and go with it. Got it.
Right.
That's helpful. So Amir, I also understand that the doctors would file the claim. I'm
Yeah.
just asking because we've not had Medicare. Just like,
Yeah.
what will be different from what normal health insurance that we have before getting
Well,
Medicare?
the doctors will make sure, well, when you sign up for the Medicare Advantage, it is really um, up to the agent who is interacting with that client to make sure they get all the doctors that they see, make sure everybody's in network, and choose the right plan. Once everybody is covered and the plan is accepted by the client and they go see the doctor will file the claim. It's not up to the client to do anything. Everything happens on the back end. So all they need to know is I go see the doctor, I tell them what my issues are, I get treated, I go home, I go have some chai, and
Oh, that reminds me. Thank you.
yes, and they don't have to really worry about anything,
Okay.
right? What Rosie is saying is that you can have two different ways. You can go a la carte, which is what she is doing, separate dental, separate prescription, separate coverage for the doctors, or what a lot of people do is put everything in one and just have that peace of mind everything is covered by this one plan, right?
Okay.
So, and it usually ends up being like she said, you get a lot of benefits. Like you can go to the gym. It's usually part of a Medicare Part C plan. You will get a membership usually. They want you to be proactive, they want you to stay healthy and fit, so they give you a lot more. These plans cover a lot more.
Okay, good to know. So, has there been instances where people have been denied Medicare coverage, or asked to pay more
There are
because
some
of
in,
pre-existing conditions?
No, no, no. You're not going to get denied because of pre-existing conditions. You will get denied if you don't pay your Part B premium for whatever reason, or if you get incarcerated, then you will lose your Medicare. And then when you come back out, you have to reapply. If you leave out of the country, you will not have your Medicare insurance. When you come back, you will get it back. Those are some very rare instances, but for the most part, you don't really lose your Medicare choice.
Okay. Okay. So, as I was reading about some of this, I also came across something that the doctor might say, "I cannot accept an assignment." Does that ring a bell, or
I have not heard of the
doesn't?
assignment.
Doesn't accept an assignment. That means the patient ends up paying 15% more for the service. Rosie, you're nodding.
I know that because I worked at a doctor's office one time,
Okay.
and they won't accept assignment,
Can you
and
can you
that's
can you tell us
what
more
it
about
is.
that? Yes, yes.
They it's kind of connected to not wanting to take Medicare patients. Also, they prefer not to, and when they don't accept assignment, it does mean you're going to have to end up paying a little bit more.
Okay.
You'll be responsible for more of the bill to the doctor, if I'm remembering correctly.
Okay.
But a lot of doctors, like right now, if I call somewhere to see a doctor, I might get the response, we're not accepting any more Medicare patients right now. That happens a lot because Medicare pays a whole lot less than your, commercial carriers.
Okay.
So
Good to know.
it's very difficult a lot of times to become a new patient somewhere.
Okay, sounds good. So, Amir, let's say we bring our parents, or someone is bringing their parents, and usually they are in 60s and plus, or they've just brought in a parent, mom and dad who just turned 65 this year. Are they
So
eligible?
yeah, as long as they get their Medicare Parts A and B, they will get the coverage, right? They will get their
But
card.
Amir, they don't have any visa.
Oh, they just came in?
They
No,
just came in this year.
no.
People, a family decided, hey, my parents they're getting aged, and I need to bring them here. And at 63 or 65, the family brings in their parents, either
Yeah,
a
there's
mom
a
or a
lot
dad.
of those cases as well. Unless it is critical, you'll still get covered here, but Medicare Part B will not go into effect. Only Part A will come in. Because to have them both, you have to have worked. So when you come in, you won't be able to get a Medicare Part C advantage. You won't be able to get Part B. You may get Part A after a certain period of time, after 2 years, but you will not get everything right away. That doesn't happen.
Oh wow! So like, what will it take for them to get on Medicare? Then do they have to stay a certain amount of years here, because they can work at that time? They've
Right.
been in India all the time.
Yeah. So what'll have to happen is, God forbid something bad happens, then they'll be covered, obviously, because that will go into effect then. Other than that, they will have to pay a la carte, really, but they will get hospital coverage. Medicare Part A will be there. Okay, they will have to see a doctor, and maybe they have to pay the full, uh, the $25, whatever it is, to see that doctor, right? And then they can apply for a low income subsidy. Now that sometimes will go into effect or not, but for the most part, it will be out of pocket.
Okay, got it.
I have met with a few clients that they want the Medicare Advantage, but when you look through everything, they have not put in those 10 years. You cannot put them in a Medicare Advantage plan because those benefits are just not available to them.
So the magic number is 10 years, not 5 years. It's 10 years.
No,
They
10
have to
years.
live here, irrespective of whether they're working or not, because it's
No,
hard to
they
get
have to
a.
work as well because they have to pay into the Social Security as well.
Oh, Amir, don't tell me. So the parents have to start working here at 65?
No, no, no. They don't have to start working at the age of 65. No. There is alternative ways to be covered. It won't be Medicare. It may be Medicaid at that point. But
Mhm.
Medicare will not be available for them. They are not going to be left on the streets or anything like that. They will have coverage. It just won't be original Medicare.
Yeah. So there's a question from Hamtum. Nice name, Hamtum. They ask, like, can you talk about a scenario where there's an age difference between a spouse and husband takes a retirement at age 65? In this case, wife won't be covered under Medicare until she reaches 65.
So you're saying that the husband gets covered first and then the wife joins? Is that what
Yeah,
you're
because
saying?
the wife might be under husband's health insurance before he turns
Actually, I'll talk about
65.
a scenario I had yesterday because I think this will answer.
Okay.
So there's a wife that is retiring from her job. She is past 65 and she is eligible for Medicare Parts A and B.
Yes.
The husband is actually younger he never took Medicare Parts B because he was covered under the wife. Okay, so now the wife is going to get original Medicare and B because she is retiring this year, so she needs coverage this year. But the husband only has A. And now what he has to do, he has to apply for Part B because now he does not have coverage under the wife anymore once she is retired. But he has worked as well, so he's put in his time, so he will be eligible. He's always had Part A. So Part B will come once he's off of the group insurance with his wife. So you know how you have a primary, thing with the wife. You can add your husband, your son, your kids, whoever can be under your plan. But once that goes away, then each individual have their own A's and B's. He never really took the B because he didn't want to pay the premium for the B for no reason.
But wait, he wasn't even eligible because he's less than 65 years old, right?
I mean, he's almost at 65. So, but for him to get B, he will have to apply and get it.
Okay.
Once he gets to his 65th birthday.
Because of his wife graduating to retirement,
correct.
He has to apply for himself separately.
He has to apply for himself
till he turns 65.
Yes. Right?
But then he's not yet 65 and he can still apply.
He can still do it 3 months before.
Okay.
Remember that initial period 3 months before?
What if the spouse is much younger, like might be 5 years difference in age?
Oh, if the spouse is younger, then she will not be eligible for Medicare. Because that has to happen at a certain at 65, right?
Right.
So she will have to go through either like a supplement plan. If it's not covered by A and B, she will have to go with private insurance, or she will have to go with Medicaid.
Okay, got it. So Rosie Waters or Amir, so children, sometimes 65-year-old, parents can have young children, might be 18 or 20, or so are children covered under Medicare under parents if they turn 65?
Up to I've never had a case like that. I mean, I guess it's possible. That's a very hard question to answer. I know with private insurance you can do up to 26 right now, but with Medicare I've never had that. That is not going to be possible.
Okay, Rosie, you also shake your head no.
I'm agreeing with the mayor. They would have to apply for Medicaid, I believe.
Okay. Sounds good. So now let's go to the question. We always hear about Medicare fraud. I know we're not discussing Medicaid, we're discussing Medicare. So can you tell us what are those, what are they talking about?
There's been a lot of instances when doctors will bill Medicare for services not provided. Okay, there has been fraud like that in the past. So they will bill Medicare for x-rays or CAT scans or visits.
So they're not even doing that service and they're billing it?
There has been many cases of that, and that is Medicare fraud. So they're collecting money from the government saying that they have provided a service, but they really did not.
Is that something that the patient can notice and mention and, might be say?
Not unless they get a bill, but these practices that do that, they will be very, very careful that they will bill services that the patient will not be responsible for out of their pocket.
Okay.
Right?
Right.
But the government does do internal checks and they do get caught.
Okay. So it's not the patient, it's actually the providers. Who could file. Okay. And so Rosie, go ahead. You're going to say something.
What happens when the provider bills Medicare, I would get what's called an EOB, an explanation of benefits. And you may look at them, you may not look at them. So the average patient is really not looking at their explanation of benefits. So then Medicare pays, and then you see a multiple charge maybe later on, and you go, I don't know what that is, and you don't bother to check. You just leave it. It's not coming out of your pocket per se.
Right.
Sometimes it is if you haven't met your deductible and you don't have a secondary, then at that point, because you have to pay the 20%, you may go, did I get this? I don't remember getting that. But just normally, the average patient does not look at the explanation of benefits with a fine tooth comb.
Wow. Okay. And so my next question, Amir, is can you tell us so when we talked about A, B, and C and D initially, you did say some of them would be coming out. People think it's free, but it's not free because it's coming out of your social security. So can you tell us what's the average? I don't does it differ from person to person, the coverage, the payment?
It's usually standard and it's usually $170.10.
Okay.
That's what the standard premium is for Medicare Part B.
Okay.
Part A does not have a premium. So a lot of times you will see your Social Security was $1,100, let's say.
Yeah.
But when you really actually get the check deposited into your bank through the government, it's not that money. The government takes out the 170, will deposit the rest.
Okay.
Right? So that money does come out. Everybody pays a Part B premium, and it's usually $170.10.
Okay. So if that's the amount needed, will a person like me need to? So we don't need to start saving for Medicare from now?
Well, it will come out of your Social Security check. That's why you have had to work 10 years, because you get those credits built up, right? You need 40 credits built up with the government before they start giving you your Social Security, and then when your Medicare comes, you've already paid into it. So therefore, you're entitled to Medicare Parts A and B. That's why it's known as an entitlement program.
Got it. And
Right.
that comes to a question with someone who registered with us yesterday for attending this session, a young teenager or probably a college grad, asked, we hear all these stories that the Social Security money is coming, is being used, and Medicaid and Medicare is depleting. So what will happen when we become 65, 40 years from now? Can we depend on these socially run programs?
So personally, I believe Medicare, Social Security will be there in some way, shape, or form. It may not be the way that it is today. If you actually go to the website on Social Security, it tells you that they're running out of money by the year 2034. Right? That is a fact. They just don't have the money because we are about 350 million people here that are putting money, and people are living longer. It's just not going to be sustainable the way it is right now. It's not going to work. But the administration, whoever it is at that time, will do something. I don't know what is going to be. I can tell you it won't be the same like it is today, but I highly doubt it's going away. It's not going to go away. It will change. It will modify. It will evolve somehow.
Okay, so
Government is
basically
not- Yeah.
you're saying, you're putting some optimism into it, and you're saying let's have hope.
Absolutely, that we have to have hope. If there's no hope, there's no joy for tomorrow. We have to have joy. We have to smile. We have to be happy to wake up every day. We don't want to wake up thinking, "Oh my God, my Medicare is going to go away."
Go ahead, Rosie. You wanted to say something.
No, sometimes I think about the next generation, like my children when they get older. But with them, Mayor, I just say there'll be something. That's why you have another plan in place. You just don't want to, there's not that many people in the workplace putting into the system like when my parents and I would worked.
Right.
It's much less right now, so something has to happen.
Okay.
Yeah.
So let's put that hope out there, but continue to question our system to make sure the money remains there. So Amir, the person has asked further that we talked about the husband getting into Medicare, and now the wife was not worked at all, right? Who has not worked at all, is a housewife. Will she get Medicare at 65 if she has not worked at all?
No, she
no.
won't.
That's
She
not
won't.
fair, Amir. Oh my gosh.
She won't. I know of a family just like that. The husband has worked. The wife was a housewife and she took care of the family. She did not have those credits required to be covered for Medicare unless something that is catastrophic that happens to her, and then Medicaid will jump in. She will not be eligible for Medicare.
Even if she's lived here for 10 years.
Yeah, it doesn't matter. She has not put in, that money has not gone in for her entitlement.
That would be so many of our Indian families then.
Yeah, I
So do
mean,
you see that often happen? Oh my gosh, that's the question I wanted to discuss in the beginning itself then.
I see it a few times. There are options like we can help them to get into Medicaid and programs such as that, but for the most part, Medicare will not be an option.
So all they have to do is just get 40 credits of
Yeah,
work?
they have to get 40 credits,
And that's how
that
many
usually
years? How many
usually
years
builds
of
up
work?
over 10 years, usually, if you're working full time.
Oh my, oh my, oh my. Okay.
Yeah.
That's okay. So that's the situation. They have to work beforehand. What happens if, but can the husband still keep private insurance and still cover her?
If he wants to, but if he's getting Medicare, I wouldn't really get it for him. I would just get the private insurance for the wife.
Okay.
I would
But then that
probably
would be
say
extra cost for the family
it will be extra cost for the family.
at that age. Okay, got it. So, Amir and Rosie, let's talk about the next steps. Oh my gosh, I learned so much, and I can now tell my friends and others who are in the age range, in the 60s age range, and I can talk about Medicare now. I wasn't comfortable talking about it before. So, thank you so much to both of you for imparting this knowledge. As I understood, you did say that the person should talk to a professional or a coach. And how? So okay. So now the providers can do some fraud. Can the professionals or those who are enrolling people into Medicare, can they do? Is there any fraud done by them? Like, can they coerce them to signing up for anything that the client doesn't need? It happens.
Happens a lot. Happens
my
plenty of
gosh.
times. Just for them to make a sale, they will say things that are not true.
Oh no.
They may use scare tactics like, if you don't sign up now, your Part B is going to go up, or the government will take away your Part A and B. There are so many things, and that is strictly against the rules that those agents could lose their license. Okay, that is something that they cannot do. They are not supposed to do. But just how, like Rosie explained, people don't really read those end of benefits. People don't really pursue reporting, and they just like, oh man, okay, I believe you. I'll just do it, and it ends there. But there have been many cases where people have called and they have complained to the government. This is what this agent has said. Is this true? If they fact check you, and if you get caught by the government, you're going to be in a lot of trouble. But does fraud happen by the agents? Yeah, absolutely does.
And they could
Absolutely.
even potentially lose their license.
They will
Practice
lose their
license.
license for misrepresentation. They will.
Okay.
They will. You want to speak to somebody that knows what they're talking about, has your best interest at heart, that is going to tell you if your doctors are still accepting clients, like how Rosie said, some of them don't, right? So the government has provided a lot of tools to check all of that first.
Okay, Rosie, you're going to add on something?
No, I'm in agreement with them, Mayor.
Okay, sounds good. There's another question. If a couple wants to retire early in their 50s, medical insurance being so expensive, what are the best options available to take care for Medicare for himself or his family, the couple, or both?
Yeah, so Medicare is not going to be an option there, right?
Right.
Medicare is going to be only if you get 65 or if you have some sort of say like disability that you have had for 2 years, then you will get Medicare. You may want to see if private insurance or the health insurance marketplace is an option for you. It is called Obamacare, right? So you can go onto that exchange and see if you qualify for something there.
Okay, sounds good. So Amir, we are into 1 minute before we close out. We would send out a follow-up email with your contacts, Amir, if people are interested in reaching out to you. Seems like you are very well aware and comfortable talking about Medicare and getting clients enrolled into Medicare and answer any questions. But Rosie, do you want me to share your contact email if people just want to understand more what are the other challenges you went through?
It's fine.
Awesome. That will be great for the listening or those who have, because people will be listening to this recorded video as well. So I'll make sure I send your contact email as well. I would now like to get your closing thoughts, please, Rosie.
My closing thoughts are: be informed, get connected to a professional, and just know, based on what the professional shares with you, take the time to make a decision that's best for you. An informed decision is how you make the best decision.
Okay, one more final question, Amir, for you before your
Sure.
closing thoughts or closing comments. Is there a minimum dollars that a person should have contributed towards Medicare while working, or is it just 10 years? From what I heard from you, it was like 40 credits.
Yeah, it's not really a dollar amount.
Yes.
It's the amount of credits that you accrue.
And each year is like probably, so each year they have certain amount of credits.
Yeah.
Okay, got it. So minimum of 10 years they should have worked in US.
Correct.
Part-time or full-time?
And paid taxes on time.
Paid taxes. Part-time
Right.
or full-time?
Doesn't matter part-time or full-time. There are some part-timers that make more money than even full-timers, right?
Got it,
So,
yeah.
Yeah.
Okay, go ahead with your closing thoughts, Amir, please.
I mean, I want to echo on what Rosie said, is really be informed. There is a lot of misinformation out there, and there's a lot of information that is not getting into the hands of people that need that information. Get with a professional. Make sure you get brochures and pamphlets and plan details, read about it. Don't just go for it the first time, but get to understand it. Make sure your doctors are covered, what the cost of your medications are, everything, what the benefits could be, and then make an informed decision on what is really good for you. That's all I would have to say. This sharing is power.
Okay, Amir, I'll make sure that I send your contact information, email, and number if it can be shared to our registered listserv. And please visit our website, chaiandjustchat.com. It's purely for the listeners and community advocates and community members on different topics. We run these chai and chat sessions every month on different topics with expert professionals and panelists to discuss various perspectives on that particular topic. This is a weekday session. Usually it's on a fourth weekend. So check out and tune in to our website for the next session for April. And we wish you a wonderful rest of the evening and the week ahead. And thank you so much again, and take care and stay safe.
So glad to be a part of it. Thank you, Nazira.
Thank you.
Thank you.
Appreciate
Thank you,
you.
Rosie. Thank you, Rosie. Thank you,
Thank
Amir.
you, Amir.
Take
You're
care.
welcome.
Bye-bye.
Bye-bye.
Have a good
Bye.
evening. Bye-bye.